YLI, or Youth Leadership Initiative, is a program where young people develop cross-cultural leadership skills, explore their culture, and learn how to take action on issues that are important to them. One key component of our program is the action teams, where youth identify and address community issues, lead teams, and engage community members through impactful service projects. By recognizing their power to drive change, they continuously learn, grow, and transform the systems that impact their communities. This year, the Mental Health Action Team created a video to raise awareness about mental health issues. The video features interviews with various individuals, including a community member, Minnesota State Representative Athena Hollins, and the youth on the team. It begins with the team's participation in the Mental Health Day on the Hill event at the Minnesota Capitol in March 2024. During this event, they learned about advocacy, visited a state representative, and shared their stories and interests in mental health. They also did research to learn about mental health and spoke with people working in the field. Throughout the video, you will see how the team documented their journey to spread awareness. Please enjoy the video. We hope you learn about this important topic and understand what our young people care about.
Myself in the beginning, but Sue Anderson, now in Minnesota. So now we're going to talk about the Adult Mental Health Bill, House File 3743 or Senate File 3701. And this has a number of things in it, some that actually cost money. So one is we have something under non-emergency medical transportation called protected transport, so that people who are in crisis can be transported with dignity in an unmarked car, not in a police car with handcuffs, not in an ambulance tied down. But we only have like 2 in the whole state of Minnesota, so we want to put a little bit more money in there to really help people. And if you're going a long distance in rural Minnesota, you'd much rather be in a car, right? Maybe looking at a book or looking at your phone, right, instead of in handcuffs. We want to actually add occupational therapy to the team of adult rehab mental health services.
Again this year, and this year I think what makes it really different is so many times in the past we have been trying to move forward proposals and we have been told, well, we need to study the issue. We have to understand the magnitude of the problem. We've been through many studies, including last year when we brought forward a rates proposal, and we were told, well, there's a study happening. Let's wait until the study's concluded. Well, now the study is done. Woo! Yes, the Department of Human Services published the Medicaid rate study that everyone has been waiting for, and it has recommendations in it. We think they are really good recommendations, and so we are working collaboratively with the network and with our legislators to bring forward proposals that will implement those recommendations.
My name is Tara Jebin Singh, and I am currently a full-time graduate student, but have worked in public policy, health, and human service administration for the last 30 years. I'm currently a candidate for Ramsey County Commissioner.
Why is mental health awareness important to you?
Mental health awareness is really important to me because I have had loved ones who have lived with severe and chronic mental illness. And I have been a provider of services in a community-based mental health agency. And I think that the more that we can make aware of mental health and mental illness in our personal and private lives, the easier we can make it for people to talk about it and to make it a really normal thing. Just like when you say, how did you sleep last night? How did you eat? How does your body feel after a long run? To say, how's your mental health?
How do you feel about the stigma about mental health?
I think stigma prevents people from being fully who they are. It keeps them from being able to express all of their emotions and to process their lives completely. And I think stigma actually leads to discrimination. That the stigma around mental illness prevents people from seeking the care that they need. It prevents them from being able to access education and schooling, to be able to be fully who they are in their workplaces, and just to live their whole lives.
Have you ever experienced mental health issues personally?
You know, I haven't had any specific diagnoses, but throughout my life, there have definitely been times where I've had lows. And, you know, maybe not a full out depression. A lot of times it followed after grief, times of loss, times of stress. And I would definitely say that there has been some trauma involved with caregiving for loved ones who had chronic illnesses. When my mom was in her last year of life, I spent a lot of time in the hospital with her. And then I had another family member who went through a severe mental illness. And there's a lot of things that I find as I go through my day, even years later, where I'll be triggered into those emotions. And I'll have to you know, kind of allow myself the time and the space to let those pass and to think about what that meant. So yeah, mental health and awareness around my own mental health is really key to staying healthy and whole.
What makes or made you want to learn more about mental health?
I would say having a loved one who was suffering, having a loved one who suffered depression and anxiety and a larger mood disorder that brought him into low lows and high highs, impacted our family in major ways. And so we tried to learn as much as we can so we could support him. And then that informed my professional life, wanting to take all that our family had learned in navigating really difficult systems and supporting loved ones through really difficult times. So that definitely impacted the work that I did. I had been in public policy and shifted to human services and have become an advocate for those living with mental illness and the families that care for them, because I realize how impactful mental health and mental illness can be throughout our community.
How would seeing a video about mental health made by teenagers help you be more effective in your work?
It'd be tremendously helpful. A lot of mental illnesses present in young people before the age of 14. And to be able to hear the voices of young people who are either experiencing those illnesses or those symptoms, or experiencing watching their friends go through it, can only help us better figure out how to support young people as these issues are coming forward. The other thing too is having a video around this will raise the awareness around the importance of mental health for everybody, for recognizing and seeking help when there's a mental illness, and reducing that stigma and allowing people to get all of the supports that they need.
Hi, I'm P-Self King or Tri-Self P-Self King. I am a sophomore this year.
Why is mental health important to you?
Mental health is important to me because I have a relative, also me, have experienced mental health since I was a kid, and it's really important because it affects me and my family too.
Why did you feel the need to make this video?
I feel the need to make this video because I want to spread awareness to others and let others know that mental health is really a big deal to face on.
Why do you think it's important to spread awareness about mental health issues?
It's really important to spread mental health issue because, like what I said, it really affects me and my relative. Sometimes like it can cost to life too, and also it's really important because you might hurt other when you're having a mental health.
My name is Caitlin, and I'm a high school student, and mental health is important to me because I believe that there are so many people suffering from it in silence, and they're too scared to speak out about it because of the stigma around mental health. I felt the need to make this video because, again, there's a big stigma about mental health, and I feel like it should just be normalized. I think it's important to spread awareness about mental health because nobody ever really talks about it, and people should know that having mental health issues is normal and is okay, and it's a part of living.
Hello, my name is Joe, and I am a junior.
So the first question is, why do you feel the need to make this video?
I feel like the video that we're making is really important to spread awareness throughout our community and especially youth, because I had some experience where even though some people heard it, I think people need to hear more about it and other people's experience as well.
So for the second question is, why do you think it's important to spread awareness about mental health?
I think it is very important to spread awareness about mental health because some people experience may not be heard, while some other people experience will be heard. And I think majority of the youth that are not sharing their experience with everybody is because they are scared of what will happen to them. Like they might be discriminated and bullied for it, because for me during the COVID era, where I was in 8th grade at the time at my school, I was very isolated and I didn't have social interactions with everybody, and that really put me down a lot because I didn't have any friends to go to. I didn't rely on my teachers that much because we were just learning online, and just talking to them through a camera doesn't really mean that much to me, because I want face to face and I want them to know how I really feel about what am I going through.
So the last question is, why is mental health important to you?
I think mental health is really important to me because I had my first mental breakdown. I was pressured into doing my assignments by my mom and my dad and the school. My mental breakdown happened after, when I was in court. Yeah, and after that, I reached out to my teacher, and then everything is good now. Yeah.
That's good. And then back to the question, why is mental health awareness important to you?
So mental health awareness is particularly important to me because I think it impacts everybody across age, race, socioeconomic status. I mean, everybody has mental health challenges and everybody is impacted by them, whether it's them personally or a loved one, or just somebody they work with or care about. So for me, being aware of mental health challenges and mental health is especially important here at the legislature because we deal with stressful deadlines, very emotional issues that can be triggering to folks who work in this space. And also it impacts my constituents, right? From young people to elderly folks, everybody has mental health issues that they're working through. And so that's why it's important to me.
How do you feel about the stigma surrounding mental health illnesses?
So this is a really good question. I will tell you, I had a partner in college who had a lot of depression and anxiety and who refused to go get any sort of treatment for their mental health. And I didn't understand why. And they told me, it'll be on my record forever. I'm so scared that this will follow me around forever. And I think things have gotten much, much better since that time when I was in college 20 years ago. I think that there is more people who have been open about their mental health struggles, more people who have emphasized the importance of good mental health, and the stigma has reduced significantly. But that being said, there still really is stigma, especially in certain communities, certain cultures, and certain groups of people. And I think that the more we can do to combat it, the better. When I think of how, especially I would say, men are treated for mental health issues, like how they are, even doctors will assume like a million different things other than it's a mental health issue. is really problematic. And so that stigma is not just like from your peers, but it's also embedded in the system. And how do we make sure that we are creating systems that are looking at people fairly and equitably? And, you know, getting rid of that stigma is part of that.
Have you ever experienced mental health issues personally?
I have. I would say I'm a pretty anxious person in general, and I've certainly had spikes in my anxiety. I've had panic attacks before, and it is a very powerless feeling. And, you know, to get back to that stigma question, I don't think I even realized it was a panic attack when I was first having them. I was like, I feel like I can't control my heart, or I can't, like, everything just hurts and I just kind of want to curl up. And it wasn't until a mental health professional was like, let's break that down a little bit, that I realized I was having a panic attack. But I wanted to assume, I was like, not me, I'm fine, my mental health is good, there's nothing terrible going on in my life, so why would I be having these panic attacks? And it wasn't until somebody from outside looked in that they were able to help me identify that.
What makes or made you want to learn more about mental health?
I mean, well, I'm a psychology undergrad major, so I've always been interested in mental health. But it's certainly become more personal for me between my own anxiety from when I was in undergrad to during the pandemic. My husband experienced some pretty severe anxiety, and how that has impacted and continues to impact our lives as well as our kids' lives, who, you know, have to deal with the situation where dad might not be as functional as he would like to be. And they've gotten really good at recognizing and accepting it, and also understanding that it's a temporary state and it's something that, you know, he needs to do breathing exercises and he'll be better. But for me, it's really important on a personal level, but also a professional level. Because like I said, in this space, there's a lot of mental health needs. And for us to be functioning in our best way possible, I think we really need to be healthy, both physically and mentally and emotionally. And I think that's when we are at our best, is when we are totally functional in every way. I think there was historically a tendency to ignore mental health in this space, which led to people drinking too much, people doing impulsive and bad behaviors. You know, I think politics in general has a history of being not kind of an unsavory space. And part of that is because there is a lot of stress put on you and people aren't paying attention to their mental health. And they're like, well, I can just ignore it. If I just, you know, have several scotches every night, then I don't have to think about how anxious I am or how sad I am. And so moving away from that sort of way of dealing with things and really trying to bring in a more healthy approach, I think is so critical to everything that we do in politics.
How would seeing a video about mental health made by teenagers help you be more effective in your work?
I think it is so important to have teenagers and young people fighting for the things that they think are important. We at the legislature tend to think that we know it all and that we have a great grasp on everything that is happening and all the issues that are around us. But, you know, as I'm constantly saying, like, the world that we're building with the decisions that we make and the bills that we pass here are going to be impacting young people more than they're impacting us. And so to hear and see their perspective allows us to really hone in on the issues that are maybe outside of our awareness because we're not in that age demographic, but are still equally as important. And it also ensures that we are looking towards the future and how we can best support folks who are coming up behind us, who will be future leaders, and making sure that they're at their absolute best. So I think it's really important. I think it would be really impactful. And I think it's nice to hear it directly from the young people who are being impacted by it, and not just from us, right? I mean, it's nice to hear it from people who actually are living this life and who are going to be impacted by the decisions we make going forward.